Hello, my amazing viewers. My name is Lucy. Today, I want us to talk about cervical dilatation. I want you to see what it is when you are told that you are 2 cm dilated or 10 cm dilated. When it comes to cervical, when it comes to pelvic, we have latent phase and active phase. Latent phase is 3 cm down. Here is the tip of finger, is 2 cm, here is 3 cm. Then from 4 cm, enter active phase. The reason why when you go to hospital after checking you, the nurse will tell you to go is when you end up having labor pains is because you are still in active phase of them. You are still 3 cm or 2 cm or a tip of a finger dilated, and if they admit you from that passive phase of labor, you will start counting from that time, whereas when you've actually entered labor is when you've reached 4 cm dilatation. And there are some women that with 2 cm dilated cervix, they will start shouting on top of their voice, not because they are feeling that pain as such, but because they are aware that labor is painful. Understand? They will start shouting because of pains of labor. If I happen to meet you, if I'm on duty and you are there, I'm behaving that way, I will go and bring my board to show you where you are and where you have to reach before you can deliver your child. So this is 10 cm dilatation. If your cervix have dilated up to this extent, your baby's head must pass through here before you can deliver your child. Then if you start pushing your baby when it is 8 cm or 9 cm dilated and the cervix has not given way for the baby to pass, this is what leads to cervical dilatation, cervical tear. After delivery of that baby, you see that you'll be bleeding profusely, that they will need to take you to theater to suture your cervix. This is not your vagina or your perineum, this is your cervix inside, because it did not allow the full dilatation of the cervix to take place before you start pushing your baby. So from here down to here, you can actually bear this pain. You can actually bear this pain because the pain comes, the severity of the pain comes with how far the cervix has dilated. If you are still here, or here, which is 3 cm, 2 cm for a finger, the pains always come like menstrual cramps for those ones that had it or are still having it. But from 4 cm, we see that the severity of the pain will be increasing gradually. But the higher the pains, the sooner you are going to see your baby. So I want you to take your time and observe this board. It is just an illustration, but this is how far your cervix must dilate before you can be able to give birth to your child. I'm talking to the first mother, first timers, the prime that will come to the hospital because it is their expected date of delivery, or because they are having a prostate contraction. They will come expecting to deliver their child as soon as possible. Your baby must pass through these processes before you can deliver that child. Just have it in mind. It has a step it will take, and it must pass through those processes before the child can be able to come out. You do not force it. Sometimes when you force it by trying to push out your baby when it is 6 cm or 7 cm dilated, if the cervix did not tear, it will swell up, that it cannot dilate again. If you listen to your healthcare provider, you hear them saying that this cervix is edematous, this cervix is edematous, it will just swell up, it will stop dilating. So that's why it is advisable not to push your baby until when you are told to do so. And have it in mind that the severe the pains, the sooner you are going to see your baby. Thank you so much, and always like and follow for more.